pain can be difficult to understand as it is often misunderstood by both medical providers as well as people. And I think it is even more the case when it comes to men that suffer with pelvic pain. So we're going to talk about some of the most common myths around male pelvic pain. The first and probably the biggest myth is that male pelvic pain is due to a prostate infection. In fact, most men will go to the urologist when they start experiencing symptoms of pelvic pain, whether that's genital pain or rectal pain or urinary dysfunction like urgency, frequency, or hesitancy with their urine stream. So men will often go to the urologist, and many urologists will hear those symptoms, and they are very, very similar to a prostate infection, and they will prescribe them antibiotics. So the proper way to diagnose a prostate infection is to actually culture or test secretions from the prostate. And so this is done at a urologist's office with a prostate massage, and you take those prostate secretions and you test them to see if there is bacteria. You can also test the urine after a prostate massage. Testing the urine alone is not sufficient to diagnose a prostate infection. So what happens is most of these men will take antibiotics, sometimes for weeks or months. Their symptoms may get a little better the first couple of days because all antibiotics do have a pain-relieving component to them, but then the symptoms just come back. So many men will undergo weeks or months of antibiotic therapy and their symptoms do not resolve. Symptoms similar to a prostate infection account for most trips, up to 90% of visits to the urologist's office. And most of these cases are indeed not prostate infections. They're due to myofascial pelvic pain or possibly a neuralgia of the pelvis. So this is the most common reason that men visit a urologist's office. The next myth that we'll talk about is that pelvic physical therapy is only for women. And this couldn't be farther from the truth. We treat, as pelvic floor physical therapists, we treat all people with a pelvis. Surprisingly, maybe to some, the male and female pelvis is remarkably similar. We have the same muscular structures, the same nervous structures, and they can become compromised for a variety of reasons. And when they are, pelvic floor physical therapy is often the most appropriate treatment or intervention. Another myth is that Kegels are only for women. Indeed, Kegels are an activity that helps to strengthen or improve the motor control for the pelvic floor. So we often think of these as exercises that we give women, particularly after they've had a baby, to treat things like incontinence. Well, they are a very appropriate exercise to also give to men who may be having similar symptoms. A common example is when a man may have a prostatectomy due to prostate cancer. Unfortunately, there are some common side effects from the surgery, one of which is urinary incontinence and another is erectile dysfunction. So Kegels, along with other strengthening activities or exercises for the pelvic floor, can help to resolve those symptoms of incontinence and improve erectile functioning. So along those same lines, many men believe, or many people believe, that pelvic pain is only something that happens to women. And again, we think of the woman who goes through childbirth and she may develop pain. Well, indeed, many men will develop pelvic pain. The research shows that 8 to 15% of men will experience pelvic pain at some point in their life. And this is likely grossly underreported, especially due to the majority of men that have pelvic pain are misdiagnosed with a prostate infection. So women have about a 20% chance of developing pelvic pain at some time in their life, and I really think that men are much more similar to that, in that probably 1 in 5 men will experience some sort of pelvic pain in their life. The last thing I want to talk about is the myth that too much sex or too much masturbating can lead to pelvic pain. And it's a little bit more complicated than that. It's not necessarily the frequency of sexual activity that leads to pain, but the type of sexual activity. So if men masturbate aggressively, particularly with over-lengthening or aggressively lengthening the penis, particularly if it's repetitively, that lengthening can result in an injury to the nerve that supplies the penis. This nerve is a branch of the pudendal nerve, and the pudendal nerve is the primary nerve that supplies the pelvis. And when this nerve is stretched repetitively, as with aggressive masturbation or aggressive sex, it can irritate that nerve, creating penile pain, particularly tip of penis pain. The other way that sexual activity may lead to pelvic pain is through delaying ejaculation, or sometimes referred to as edging. When folks delay ejaculation, they typically contract their pelvic floor muscles. If this is done repetitively, the contraction of those pelvic floor muscles may lead to those muscles not being able to relax fully, and that can lead to pelvic pain. So those are the most common myths with male pelvic pain, and if you want or need more information, drop us a question and we'll be happy to get back to you.